Good evening, everyone. Myself, Gurjeet. I'm working as a nursing officer in CTVS ICU of AIIMS, New Delhi. I'm going to present a case on the topic challenging decision of continuity of nursing care in a pediatric cardiac ICU resulting in family satisfaction. So, starting with a brief history of my patient. My patient is a 1 year, 5 month old child. She was referred to AIIMS from a hospital in Panipat with a history of bluish discoloration since birth that was seen more during crying and feeding. And there was a history of suppressed hug cycle was also there. And this child, she was born out of a non-consanguineous marriage. She was a full-term normal vaginal delivery with no birth complication. She was discharged on day 2 of life with no NICU stay. And there is no history of any heart disease in the family. Now, I'll briefly explain the hospital course of this child. On 16 December 2020, echo was done, final diagnosis was made in AIIMS, and child was planned for surgery. On 24 June, BD gland and PDA ligation was done for the child, and after that, extubation was planned for the child as per the normal course. So 2 days after the surgery, she was extubated, but within few hours of extubation, the child, she was reintubated again because of CO2 retention. After that, there were several trials were given to wean the child off the ventilator, but all were unsuccessful as she was not responding well. And after that, fluoroscopy was done to rule out the movement of to rule out any issues with the diaphragm movement. And it was seen that she was having bilateral diaphragmatic palsy, and for that, diaphragmatic plication was done. Even after that, child didn't responded well, and tracheostomy was done, and she was continued on positive pressure ventilation with alternate CPAP and SIMV. So, after that, the child, she is still receiving care in ICU. Now, the major nursing challenges they started when the discharge was planned for the child. We started health teachings of the family on the various topics like tracheostomy care, identification of emergency signs in case the child desaturate or anything else, and suctioning and all. But after so many sessions of health teachings, it was in this family, they were still apprehensive while caring for the child. As they have seen in the ICU, they have seen many times that the child is tachypneic, she is desaturated, and she goes into bradycardia, even while feeding, while changing diapers, and even just sitting. Moreover, the family, she belongs to a very poor family, and they come from a very remote and rural area. There is no hospital nearby in case any emergency happens with the child. So, in view of all these conditions, the group of senior ICU nurses, they discussed it with the surgeons and medical team and intensivist, and it was decided that the care of this child will continue the care of this child in the ICU. Now, I'll briefly explain the continuity of care. Continuity of care is concerned with the quality of care over time. It is the process by which the patient and his or her physician-led care team are cooperatively involved in ongoing healthcare management towards a shared goal of high quality, cost-effective care. Nurses, they played a very important role in caring for this child, as during the hospital stay, the needs of the child, they changed over time, and nurses cater to the needs of the child very well. Then they tried their best to involve the family in the care of the child, and family, they also responded very well, and their efforts in caring for the child, they were quite appreciable. On our side too, we helped the family in all the ways possible. As the child is from a poor family, we provided the mother with the food and all those things. So we tried our best to support the family. But as the child stayed in ICU for around 3 months, she developed a very good relationship with the staff. As almost all the nurses in the ICU, they cared for the child based on their assignments. The main nursing care that the main care that's provided by nurses is like they provided nebulizations, physiotherapy sessions, tracheostomy care, drug administration, and ICU tube feedings, etc. During the course of ICU, say the child improved. She gained weight, her milestones improved. As she was having tracheostomy tube in situ, so she was not able to speak even, but she still used to express by smiling, by handshaking, and she learned to say no or yes. The family, they also got positive reinforcement as they have seen the child improving, and the staff, they too get the positive reinforcement to care for the child. and they did their best to do for caring this child. And to conclude, the continuity of care for selected cases can be adopted to understand the major challenges in the patient needs, to develop a good relationship over time with the child to make her comfortable, to develop a consistency and coordination caregiving team, and to understand the needs of the family and ensure family satisfaction. Pediatric cardiac intensive care nurses, they play a very great role, especially in long-term patients, as challenges in providing care and needs of the child change with ICU stay. They may get infection. There are so many things that change while if the child stays in ICU for a long time. So the pediatric care nurses, they play a very important role in caring for long-term patients. Thank you.
Very well presented. Child stay